Hi, my name is Amanda McDonald, and I am here with Joshua Davis, a classmate of mine, and we are on rotation with Dr. McClendon for our geriatrics rotation. And so we are going to go over urinary tract infections, no symptoms, no treatment. And so first of all, antibiotic stewardship is a very important role that we all can play a part in. So approximately 70% of long-term care residents received antibiotics during the last year, and 40% of all medications that are prescribed at a long-term care facility are antibiotics. Why this is important is overuse of antibiotics can lead to increased adverse drug events, drug interactions with other medications, C. difficile infections, and then also antibiotic resistance. So to go into detail about our different types of UTIs, we have asymptomatic bacteriuria first, and that refers to isolation of bacteria in the urine culture from a patient without symptoms and signs of a UTI. So this would be whenever your patient has no symptoms, like a fever or anything like that, and they do have bacteria in their urine. So urine with white blood cells, pyuria, with or without bacteria is not an indication for urine culture or antibiotics. So the presence of white blood cells in the urine is not specific. It only indicates that there's some type of inflammation. So white blood cells may be present in urine due to non-infectious causes such as urinary catheter or a kidney stone. Prevalence is higher in women than men, but it affects both males and females more in LTCFs than elderly individuals in a community setting. So 25 to 50% of elderly women in long-term care facilities report having an asymptomatic bacteriuria, compared to only 10 to 15% of those that live in the community. So that's a big difference between 25 to 50 and 15%. Treatment is not recommended for most patients due to the risk of side effects and then also lack of clinical evidence. So no symptoms, no treatment. And as you can see in our little chart, if you have an older resident or someone who has a short-term, less than 30 days indwelling catheter, you would not use an antibiotic and you would not screen for any type of bacteria. To aid in prevention of UTIs, you want to encourage sufficient water intake. You also want to avoid coffee or soft drinks. They can be irritating. And then also you want to make sure that you're promoting genital and urinary hygiene.
All right, so moving on from asymptomatic bacteria, we're going to have a brief review of urinary tract infections, true urinary tract infections. These can be differentiated into cystitis, which is an infection of the lower urinary tract, including the bladder and the urethra, and polynephritis, which is an infection of the upper urinary tract, including the kidneys. So these two UTIs can also be differentiated in the presentation of symptoms. So cystitis, the common symptoms you'll see with this are fever, increased urinary urgency and frequency, nocturia, dysuria, and hematuria. For pyelonephritis, patients can also present with these symptoms, but it's more characterized by the appearance of flank pain, nausea and vomiting, and malaise. So it is important to also mention that changes in mentation can accompany urinary tract infection, and these can also lead to an increased risk of falls, especially in our older adults. However, changes in acute mental status and with or without falls is not an indication for antibiotic therapy. It should also accompany these symptoms and culture and sensitivity reports. Now, if antibiotics are indicated, cystitis generally requires shorter-term treatment between 3 and 5 days compared to pyelonephritis, which is between 7 and 14 days. There are many different antibiotics that can be used for the treatment of UTIs. However, we're mainly going to focus on some of the major ones, as well as some of the things you should keep in mind with their use. So the drug of choice for acute cystitis is macrobid or nitrofurantoin. However, it should be noted that macrobid should never be used for pyelonephritis, as it does not reach high enough concentrations in the upper urinary tract, resulting in subtherapeutic effect and can actually lead to progression of the infection. Some things to know about nitrofurantoin: it can cause severe nausea, so it's best to be given with meals and water. And it can cause some benign urine discoloration as well. And lastly, it should be avoided in patients with severe kidney disease. Next, we're moving on to Bactrim or sulfamethoxazole trimethoprim. The main things to know about this is it can cause photosensitivity, and we encourage patients to take it with water because it can cause crystalluria. And as the name suggests, it is a sulfa antibiotic, so patients with a documented sulfa allergy should avoid taking Bactrim. And the final medications we're going to cover are the quinolones. This includes ciprofloxacin, brand name Cipro, and levofloxacin, brand name Levaquin. These are very, very potent antibiotics and are usually reserved for last line therapy. This is mainly due to their extensive adverse effect profile. This includes a rare adverse effect, but something that we should keep in mind, especially with our older adults. This includes spontaneous tendon rupture, usually of the Achilles tendon. Also, it can cause glucose disturbances and CNS and psychiatric effects. These include agitation, seizures, confusion, delirium, among others. And it should also be noted that this drug does prolong QT interval. So in patients with prolonged QT at baseline, it should be avoided. But you also want to make sure that you monitor the other medications that these patients are taking, specifically antiarrhythmics, antipsychotics, antidepressants, and antiemetics, as these can also prolong QT interval. And that is all we had for you today, and thank you for watching.